Good afternoon and welcome back. I hope everyone enjoyed the weekend. Obviously, it was a beautiful weather, and we would certainly want to extend our thanks to all those veterans organizations and many San Diegans who took time out over this Memorial Day weekend to honor our fallen heroes. I know that the ceremonies were different this year, and for safety reasons, we had to make some changes in the normal traditions that we have. But I'm sure that all the ceremonies were no less heartfelt. As we begin to ease into summer, we're going to start seeing more changes in our response to this pandemic. During the last few weeks, we have been loosening restrictions, allowing us to dine in, to shop in stores, and to enjoy the outdoors more. Today, we're going to discuss some additional changes as we work to reopen different aspects of our society. One of the biggest changes involves our houses of worship. Over the weekend, the state announced new guidelines allowing for services with restrictions at churches, synagogues, temples, and other places of worship. These new guidelines allow for parishioners to gather at a place of worship, but limit attendance to 25% of a building capacity or 100 people, whichever is lower. This limit will be in effect initially for 21 days, and then we will review and assess its impact. There are many other guidelines for staff and volunteers, but I'm going to touch on only a few of them today. We're asking that places of worship modify singing, group recitations, and other practices that may increase the transmission of the contaminated droplets. For example, limit the number of people singing and space people at least 6 feet apart. We are also asking that places of worship modify practices that might encourage the spread of COVID-19, like avoiding the use of common cups and offering prepackaged communion instead of placing it on the tongue. All of these changes that we're talking about will be effective as of midnight tonight. We know that practicing and sharing your faith is important, but we want to make sure we keep everyone safe. Throughout the nation, there have been reports of services that were held without precautions and without following safety guidelines, and those services led to the spread of the virus. We don't want that to happen here in San Diego. We thank the many places of worship that have held virtual services over the last several weeks and avoided putting their parishioners at risk. We encourage vulnerable populations and those with underlying conditions to continue staying at home to avoid these public gatherings. These new guidelines will allow everyone to practice their faith, but also to keep it safe. There's some more good news that's coming for all you long hairs. Supervisor Fletcher is going to have some really good news in regards to the opening up of the ability to get haircuts. So with that, let me call up Supervisor Fletcher.
I think Supervisor Cox is picking on me as the person most in need of a haircut. But today the governor did announce some additional changes to the statewide order. These are changes in San Diego County that now allow barbershops and hair salons to reopen. It is really important as a region that as we move into some of these activities and some of these entities that represent a higher risk of transmission. They represent greater intensity and duration of exposure to one another in closer proximity. It's important as we move into these that we must be cautious, we must be vigilant, and we must be very careful and very safe in what we do. We've often talked about April being a month of action, May being a month of adapting, and as we continue to open up more sectors of our economy and as we continue to move into some of these new entities, it is vitally important that as a people we adhere to those things that mitigate the risk of spread. Face coverings, temperature checks, hand washing, and physical distancing. Those are really the four corners of the things that we're asking everyone to adhere to as best as possible as we move forward, because those are the things that mitigate risk. It's about limiting risk, limiting exposure, limiting transmission. And if we do those things in conjunction with our rigorous testing, tracing, and treatment, then our hope is we can move through this and continue to see forward progress. But we have to exercise caution. We have to exercise restraint. And we have to still understand that even though what we are able to get out and do is changing, the danger from coronavirus remains. And so that is, again, adapting our behavior as we move forward to ensure that we can continue to have steady progress. For many weeks now, we've been in a position of reopening, whether it be steps around beaches and parks and outdoor recreational activities, retail, in-store dining, now moving forward into hair and barbershops. We want to continue that forward progress into all of those entities that remain out there. But our county adopted unanimously our attestation to the state, which included a number of triggers. And those are triggers that are put in place as a part of our ability to move forward. And if we see spikes and increases in our numbers, then those triggers will guide our ability to continue to move forward. And if they are severe enough in change, would guide our necessity of moving backwards. None of us want that. We want to continue to move forward, and we want to continue to embrace each one of these reopening phases responsibly, smartly, and safely. And so we continue to urge the public to join with us in making sure that as we go forward into some of these, that we continue to be the model county which we have been from the very beginning of this action. So with today's actions, the governor is allowing San Diego County to move forward with hair salons and barbershops. We're going to pull up a slide here with a couple things you need to keep in mind. The first one is you must complete the county safe reopening plan. That is available on our website, coronavirus-sd.com. Fill out that plan, post it, share it with your employees. You need to post the guidelines there for customers to see. There's a number of things in there: temperature checks or health screening for employees at the beginning and ends of shifts, providing face coverings for staff and customers. Customers can feel free to bring their own, but if they do not, you need to have them on hand for your customers. If an employee is sick or has symptoms, they should not go into the salon or barbershop. And there's frequent cleaning schedules and guidance that is put in the state guidance that will help hair salons and barbershops as they begin to reopen. We have a quick do's and don'ts here. Do only service where customers, workers and customers can wear face coverings for the entirety of service. So that means services cannot be performed without face coverings. Things like eyelash services, eyebrow waxing and threadings, facials and shaves are not allowable. This is simply around the hair type issues, things that you can do with the face covering on. And today's actions do not include nail salons. The governor alluded to the fact that these would be coming soon, but they are not presently allowable. So it's just hair salons and barbershops. Fill out your safe reopening plan, follow the guidance, and you are clear to open. I also wanted to provide a couple of quick updates. We got a number of questions over the weekend about essential businesses. Those were our early businesses, and they've been open the entire duration of this. There were some questions about whether they needed to do temperature checks. They do. Every business that is open today, whether you are an essential business that have been open throughout the duration of this, or you're one of the new reopened businesses, need to be doing temperature checks for employees coming to work. Need to be ensuring that everyone in your location is wearing face coverings, maintaining physical distancing, washing your hands, and also doing frequent cleaning and hygiene protocols throughout your facility. I also wanted to share we're amending our public health order regarding lessons or instructions for sports. Starting tomorrow, Wednesday, May 22nd, one-on-one instruction, one instructor, one student for sports activities will be allowed. Only when physical distancing can be followed. So this could include things like golf and tennis instruction, baseball, soccer, basketball, hockey, but again, it is one-on-one. One instructor, one student. This does not, we are not at the point yet, we hope to be there soon, where we can authorize youth sports and activities and things like that to happen, but we are not there right now, but we are at the phase to allow one-on-one instructions moving forward. With that, let's jump into our daily charts here. Testing, we saw significant progress over the weekend. Again, we always have a lull on Monday and Tuesday coming out of the weekend. So you can see there today we're reporting 3,908 tests, but you can see our rolling 7-day average is over 4,000, 4,219. So we continue to make great progress in our testing capacity and what we're able to execute on daily. Contact tracers, again, continue to climb. We're now at 369. Contact tracers that are out and available. A couple things coming where we think we'll see some additional jumps in that moving forward. But just as we are very close to our testing goal, we're very close to our initial tracing goal, and both of those entities are progressing well. And then you can see on our treatment the availability of our public health motel rooms for folks who need them for isolation. For today's total, we're reporting 85 new positive cases. Again, that is out of the 3,908 that we are doing. I think we're going to update the chart that's on the screen right now. I think that is an old one, but we will get you the updated one. But for today's totals, it's 85 new cases out of 3,908 that are being reported. Today's hospital census. Okay, again, we've got an outdated chart here. We'll get you the updated one, but today's ICUs is 160 and 385 out of the totals. Let's jump ahead and see if our hospitalization one is correct. All right, so we've got the wrong day for all of them. But I will share with you our total hospitalization rate today is 3,841, which puts us well below not only our current bed capacity, but also below that 80% threshold or cutoff that we face. And our current ICU, again, 160 COVID, 278 non-COVID, puts us at 438, which puts us at about 62% of our area's ICU beds are currently being utilized. We apologize for the error in the slides. We will get the correct ones and post those to make sure that they're available for the media and all of the public as well in the coming minutes, I suspect. That concludes my report. I'll now turn it over to Dr. Wooten for a public health officer's briefing.
Thank you, Supervisor Fletcher. Good afternoon, everyone, and welcome to our afternoon briefing. So, for COVID-19 statistics ending this week, or beginning this week, global, national, and state statistics are based on our Johns Hopkins dashboard, and you'll see them here. Globally, there is almost 5,600,000 positive cases, including over 348,000 deaths. Nationwide, the United States is reporting almost 1.7 million positive cases, which is still 30% of global number and includes almost 98,500 deaths. Statewide, California is reporting 96,679 positive cases, which includes 3,774 deaths. Today, the County of San Diego is reporting 6,882 cases, which is 85 more cases than yesterday, as well as 249 deaths included in the total number. We have had no new deaths over the past 3 days. The age range remains the same from 3 months to 101 years of age. The age group of 20 to 49 years of age also is very similar at 52%, which represents 3,575 cases. And 50% of males and 50% of female represents the gender for the total number of cases. We have 1,255, or 18% of cases, hospitalized. And of this hospitalized number, 375, or 5%, of the total number of cases have been admitted to the ICU. And this number represents 30% of those total number of individuals hospitalized. For today, May 26th, the county has surge capacity for hospitalization at 37% and ICU admission at 38%, both exceeding our 35% target for surge capacity. For the deaths, we have 249 deaths, and this represents approximately 4% of the total number of cases. Of this total number, 43% are female, 57% were male. 240 had underlying medical conditions, which represents 96% of the total number of deaths, and 8 currently have no underlying medical conditions, which represents 3% of the total number of deaths. And as usual, our sincerest sympathies go out to the families and friends of the individuals that have previously been announced as victims and who have lost their lives to COVID-19. As a reminder, all of our stats are located on our website, shown at the bottom of this slide, and also on the sign in front of me. In regards to the reported outbreaks in congregate and community settings, to date there have been a cumulative total of 77 confirmed active outbreaks. Of the active outbreaks, 53 are in congregate facilities. We have not had any new outbreaks since yesterday, and this represents a total number of congregate cases at 1,482, or 22% of the total COVID-19 positive cases, and this includes 122 deaths. We also have 24 active outbreaks in community setting locations. There have been no new outbreaks since yesterday. This represents 316 cases and includes 5 deaths. Now I'll go into a series of 5 slides just to renew your information about metrics that we are following. This slide shows our epi curve, and as you can see on the slide here, it appears that we may have peaked from April 20th to May 1st. But I want to call everyone's attention to 2 facts. The first is the area where the bar is located means that that's the incubation period. So we may see new or more cases in that area. This slides over by 1 day every day. And the second is, as was stated earlier, as we are opening back up, we will continuously to aggressively monitor all of our metrics, because while we may have peaked, if people are complacent, do not adhere to social distancing, mask coverings, hygiene and sanitation, and the screenings, the numbers could peak again. So we want people to be very mindful of that. The second slide shows the influenza-like illnesses represented by the yellow line, and then COVID syndromic illnesses represented by the green line. The latter is at 1%, and the ILI is at 2%. 2% is our community baseline. So this is tracking very well, and we will continue to monitor. The second, or the next slide, shows our capacity for hospitalization. It shows, and this is, yeah, these are O2. The slides I have, and I'll just go through the slides that I have, is for May 25th. We had a total number of hospitalizations at 3,841, which is 63% of our total capacity, meaning we have 37% surge capacity. And then the next slide I wanted to show was related to the ICU, and there we have 62% of our beds occupied as of 5/25, leaving again 38% of surge capacity. So again, both exceed our target surge capacity of 35%. And lastly, just want to emphasize the fact, as I've already stated, that as we continue to conduct more testing, we expect to see more positive cases, and will approach our goal of testing approximately 5,000 people per day. We are currently at 4,219, as Supervisor Fletcher stated, in terms of our daily rolling 7-day average. So we are almost there, and we will continue these efforts. Currently, we are maintaining the federal and state metrics. However, the next 21 days are essential to maintain our progress. So as we move to reopen more and more businesses and activities, we must continue to be vigilant in our personal and collective efforts by the public adhering to the social distancing and face covering orders and the other strategies that I've already mentioned. So thank you very much, and now please welcome back to the podium Supervisor and Chairman Greg Cox.
Okay, we'll take a couple of questions. We're getting the correct information set up so that Supervisor Fletcher can come back up in just a couple of minutes to go over the latest data. Let's go to the first question.
Jennifer Kastner with ABC 10. Please state your question.
Hi, this has to do with flagship cruises in the San Diego Bay. They were issued a citation over the holiday weekend for violating a county health order. That order would be Section 14C, which bans recreational boating unless all the passengers are from the same household. The company is saying that they are operating under county health order 14E section, which states in part that other public or private indoor recreational facilities, including recreational equipment such as bicycle, boat, kayak, equestrian, and surfboard rentals, may be open for limited use. And they are continuing to operate today and say they will continue to operate through the week into next weekend. So our question is, can this company keep operating in that capacity, or are they in fact violating the county health order?
Okay, Supervisor Fletcher is going to respond.
Thank you. The boating requirements that are currently in place are limited to households only. The rental items that they're alluding to are individual use type things like a bicycle or a kayak or a surfboard. And so they are not covered under the current public health order, and we understand everyone's desire to get back up and running as soon as possible, but they're simply not covered. And if they continue to operate, they're going to continue to be cited. And so our best advice and guidance to them is just to hang on. We're trying to get through all of the various stages and things we can do as quickly as possible, but that is not one use that's currently allowable under the public health orders.
Thank you. And can I ask one more quick question related to salons? Just looking for clarification about salon openings. Are they clear to open immediately once they meet the criteria?
They are. Once they complete the safe reopening plan, which is on the county's website, they share that with their employees and they post it outside, and they're able to comply with all of the components of that, then they are cleared to open effective immediately once they complete those steps.
Thank you.
Yep.
Okay, next question.
Matt Hoffman with KPBS. Please state your question.
Hi. First, just looking for the county's overall reaction to the Memorial Day weekend with COVID-19 restrictions in place at beaches and restaurants. I know you guys obviously shut down that one business Friday. Any others countywide over the holiday weekend?
I'm going to ask Supervisor Fletcher to respond to that.
Yeah, thank you, Matt. Look, I think by and large, San Diegans have done really good job. There's always going to be an isolated incident here or there, but I think on the whole, I went out to the beaches in San Diego, and between the lifeguards and the police, they were doing a very thorough and appropriately kind level of enforcement to keep people moving along. Obviously, the situation in Carlsbad flared up a little bit this weekend. The police chief has come out and said that they didn't meet the mark for enforcement that they expect, and they will be stepping up their enforcement surrounding that as we move forward. So I would say by and large, we're doing a really good job as a region, and we just want to continue that because our ability to continue moving forward is predicated on our ability as a community to continue to adhere to the guidance, to continue to adapt, continue to do things safely. And so our hope is that we move forward, we'll continue to have that same level of cooperation, which is what will facilitate us continuing to advance.
Gotcha. And then I know that the governor said today that counties bear more responsibility and accountability when it comes to reopening, especially with these like local control carve-outs. How are you all gauging, like when the state issues guidance, like today, for example, with barbershops, how are you all deciding like when it's safe to make that move here? I know obviously the governor announced it today and we're making that jump already. Like how do you guys kind of gauge whether or not we're ready for that?
Well, in our what we called our attestation to the state, which is where we outlined the metrics, many of which they requested to show that we're in compliance with those. Provided we remain in compliance with those, then we believe we can continue to move forward. At a point at which those trigger and move in a different direction, then we would have to reassess our ability to move forward. But right now, based on the numbers, based on the data we see, it allows us to keep advancing. But again, though, a point that we're trying to really reiterate is as we move into some of these entities that have a higher risk based on intensity and duration, indoor religious services, some things around haircuts and those types of things, we're asking the public's recommitment to be very vigilant about adhering to all of the things we put out that are designed to mitigate risk and mitigate spread. And so it's not just a matter of we just keep moving through. It's recognizing as we get deeper into reopening, we're reopening things that present a greater probability or possibility of spread, which is why we really need the public to continue to work with us, to follow the guidance. We need our employers to be responsible and do the right things because we want to continue to move forward.
Thank you.
Okay, let's go to the next question.
Bridget Naso with NBC7, please state your question.
Hello, thank you. Supervisor Fletcher, you touched on this, but I want you to, if you can delve a little deeper into this, as people were watching this over the weekend, again, the city of Carlsbad, two different, really up in that area, two different philosophies, guidelines as to what they were going to do on beaches. City of Carlsbad, people were sitting, not complying, and police said they were choosing to educate versus making the move, compared to the state beach just a few miles away where people were told they had to comply and they couldn't sit. What was that discussion like in order to move the city of Carlsbad to a place where they said they were going to increase their enforcement?
Okay, Supervisor.
Thank you, Bridget. You know, from the outset of this, there is local jurisdictions do have a lot of discretion, both in terms of their enforcement posture and in terms of what they do in each of their jurisdictions. And so, you know, the Carlsbad police chief basically said, "Hey, we didn't meet the mark for what we expect of ourselves and what we think we should do," and they're going to move forward with an increased posture and an increased enforcement presence moving forward. And that's all we can expect is you know, if something's not quite right, then folks step up and say, "Hey, we're going to do a little bit better job here." And so we appreciate what they're doing, and we appreciate the way they're moving. And we recognize that this is a burden on law enforcement. Law enforcement is not used to walking up and down beaches telling people not to lay down. We're asking them to do more than what they normally do. And so it's been a challenge for them, and I think by and large they've done a good job. And in this instance, you know, they're going to do it a little bit different moving forward. And you know, we continue to work with the coastal mayors, and we hope this week to maybe have some updates about what future activities may be allowable on the beaches. But while we're in a current posture, we really do depend on our partners to ensure compliance as best they can. And so we appreciate what they're doing moving forward, and we'll continue to work with all of the cities and jurisdictions, understanding their challenges, but also understanding we all share the same goal, which is to continue our reopening, which means we have to continue to protect public health.
Next question.
Danny Freeman with NBC7, please state your question.
Afternoon, everyone. Question is, I think, pretty straightforward. Is the reality that a Phase 3 pilot program will not happen for San Diego at this point, since it appears that the governor wants to reopen things like barbershops or gyms step by step? And do you think the pilot program proposal influenced the state's policy at all?
I'll let Supervisor Fletcher respond.
I think what influences the state decisions that are being made is the data. I think from the beginning they've said that they're going to make decisions based on the public health data, based on the science, based on what allows us to move forward in the right direction. The governor has said, though, that he does believe in localism and he wants to provide locals as much flexibility as they can. And I think that they've crafted an arrangement where if you can attest that you meet these criteria, you get to move a little bit faster than everyone else, provided we continue to meet those criteria and new things get added into that category, then we'll continue to advance forward. But it is going to be county by county dependent based on those metrics that we shared as a part of our attestation. And so, you know, we haven't heard back directly on a pilot for San Diego County, but we are seeing progress on a number of those things that were listed in our request. And so, you know, barring word coming back about a pilot, then we will continue to advance. I also think it's important to note, Danny, how far we've come in a very short time. We are moving at a very rapid pace through the reopening. And so, again, you know, we want to continue to have widespread cooperation so that we can continue moving forward as we move into more folks being out and more folks being in close proximity to one another.
Thank you.
Okay, next question.
Brandon Lewis with CBS 8. Please state your question.
Just a couple clarifying questions. Last Thursday, the Restaurant Association said that people should only dine with their household, but the health order says people can dine with anyone that they ask to be seated with. Can you clarify why the health order is written that way and whether there's a concern for those who perhaps choose to eat with people that they don't live with?
Okay, Dr. Wooten will respond.
In the health office's order, it was either or. Individuals can dine with household members or anyone else that they want to be seated at their table. So that's what's in the order, and that's what we are following.
And is there a concern for the people who perhaps are sitting in close proximity to others who don't live in the household?
Again, we are opening up, and we're trying to get back to some semblance of normality. So that right now is what we're doing with restaurant in restaurant dining, with 6 feet separation of all of the other tables. So, and if a table cannot be moved, then the requirement is to have a barrier between tables to provide that protection for individuals seated in their respective tables.
Thank you. And I just wanted to clarify something that Supervisor Fletcher said earlier. He said businesses need to do temperature checks for employees coming to work. And wondering if the county can clarify if they also need to screen employees who work outside of the physical building, like these one-on-one instructors who meet with clients. Does their employer perhaps need to check their temperatures?
Well, we actually did set up that requirement for golfers because that was a business and individuals, disparate individuals were coming in. So that is a requirement for golfers, and we will be assessing if we will continue that requirement for other businesses as well. But it is expected for employees, not just the individuals that are coming into the facility.
Thank you.
Okay, let's go to the next question.
Paul Sisson with the San Diego Union Tribune. Please state your question.
Hi, thank you. It's been at least 5 days, and in one case more than 5 days now, since we've had some casinos reopen in San Diego County. I wonder, has the county epidemiology department detected any positive COVID tests among casino visitors?
Okay, Dr. Wooten will respond.
Thank you for that question, Paul. And that would be a great question to ask in another 21 days about all of the other businesses that we've opened up. But to date, we do not have any cases or outbreaks associated with the casino. Thank you.
Another question. Last Friday, I talked to Dr. on this call regarding investigation of cases and contact of close contacts.
Who did you talk to?
The goal is, I'm sorry?
Who did you talk to? I'm sorry.
Dr. McDonald during the press conference on Friday.
Okay, yeah, go on and state your question. Dr. McDonald is here.
Sure. It wasn't clear to me. He said that they intended to do all case investigations within 24 hours and all conversations with close contacts within 24 hours. So that sounds like they want to get to close contacts within 48 hours. What I'd like to know is whether or not the county is meeting those goals or not.
Well, before Dr. McDonald comes up, those are actually metrics that the state will require of us and that we'll have to report. So I will invite Dr. McDonald up to the podium.
Yes, thanks for that question, Paul. We're actually doing quite well with meeting our goals for doing the initial investigation upon hearing about a positive lab result or a case that's reported to us. Our goal is to have over 90% of those, actually, we'd like to 100%, but well over 90% in the first 24 hours when we get the initial report. And then from that individual, when we get case contacts, we have a goal of having over 90% of those individuals contacted within 24 hours. So it would be well within 48 hours for that entire evolution. Most of our close contacts turn out to be family members, and so we can actually get that done in a very expeditious process for individuals who are still at home. It's a lot longer when an individual is doesn't have any family members that we can talk to, or maybe in the intensive care unit, and so there is a little bit of flexibility in there with how long it takes for us to complete the entire investigation. But we have been doing both case investigations and close contact investigations really since the outbreak began. And with the current volume, which has been relatively steady, I think if you've seen on our daily metrics, with the increased numbers of contact tracers coming in, even over the weekend, we were able to do better than 90% in terms of contacting individuals and contacting their close contacts within 24 hours.
Okay, so in both cases, you feel like you're meeting your threshold for timeliness?
I think we're doing very well right now. I think that, again, it'll be interesting to see how things change now that things are opening up. With individuals having less interaction in public under the former guidelines before things were opened up, so to speak, it was actually easier to get a history from many individuals because they were at home most of the time, or they sometimes were even able to identify the specific event or likely person who they might have been exposed by. I think now with many more interactions that may be more challenging, but the good news is, as you saw from the numbers presented earlier, the number of contact tracers we have is going up every day, and those individuals are getting more and more experience under their belts. So I think things are looking good with the current trajectory of cases.
Thank you.
Okay, we have one final call-in question.
Hello, caller with the last four digits of 9364. Can you please state your name and outlet?
There is no question.
Okay,
Thank
you're
you.
just
I'm with
listening.
Nathan Fletcher's office.
Sure, okay.
Okay, we're going to go to the texted questions, and we'll ask for the first question to come up, or do you want to do the slides now?
No, we'll do the slides at the end.
Okay.
Okay, we'll start with our first question is from Kristen Takeda with the Union Tribune. Some high schools are organizing socially distant commencement ceremonies held at a drive-in theater with cars spaced 10 feet apart and people remaining in their cars. I've received questions about whether those are allowed or would those not be allowed because they are considered gatherings. What are acceptable and non-acceptable graduation celebrations, and if drive-in theater commencements are considered gatherings, why are car parades and general drive-in movies allowed but not drive-in commencement ceremonies?
Okay, Dr. Wooten's going to respond.
Thank you for the opportunity to clarify that. Drive-through and drive-in commencement ceremonies are allowed. I've had several meetings with the San Diego County Office of Education, as well as the 42 school superintendents from the 42 school districts in the county. So we have provided guidance for these superintendents, and some of these types of events have already occurred.
All right, thank you. And then I have another question from Kelly with Fox 5. Are HOA pools allowed to reopen? We've heard reports of at least 2 that have.
Well, we included the HOA pools in our pilot program that was requested or submitted to the state, and so it was originally intended for stage 3. And since we haven't heard back regarding the pilot, HOA pools are still not allowed to operate. We may hear guidance in the coming weeks, but today, not allowed per our current health officer's order.
And I have a question from Claudia with Univision. She wants some clarification on the salon openings, whether it's today or at midnight, and also a clarification on the do's and don'ts. Are facials, eyelashes, eyebrows allowed as long as people are wearing face coverings or are on the same, or is it the same boat in nail salons?
So our health officer's order says, states that everything therein is effective at midnight. Today's Tuesday on Wednesday. So, and I would think it would be very unlikely that any salon, having had the announcement made by the governor today, would be able to operate between now and close of business today. So this is effective as of midnight tonight, and the guidance is clearly identified in the state governor's order. Number one, both the operator as well as the customer must wear face coverings at all times. There are no services provided for the face, eyebrows, facials, or things of that nature. Only hair, both in barbershops as well as salons.
And as long as you're up there. I have one from Taryn Menta with KPBS. It's actually two. The county has now reported 0 deaths over the last 3 days. Are you aware of any deaths where COVID is suspected, but you're just waiting for confirmation? And if so, how many? If not, what does the 0 deaths over the last few days mean to you?
Well, it probably indicates, you know, we've had a holiday. Usually there's a process, as Dr. McDonald and myself have explained how the process works through our EPI program as well as our Vital Records program. So I think the fact that there have been no reported deaths is much an indication of the fact that we've had a holiday. So we anticipate that we will see increased number of deaths tomorrow and continuing in the week.
Okay. And the second part, the county announced earlier this month that tennis courts could open with some modifications, but I've heard that many facilities still have not opened because they are still awaiting approval. What is the delay in allowing tennis clubs to reopen?
Well, to be quite honest with you, actually in the health officer's order, they could have already been open. I believe it is related to, I can just find that, number 16E II. So that actually provides the cover for any type of outdoor recreational facility to operate. So we are announcing it today because we have the guidance there, but we've been getting a lot of emails, so we wanted to provide clarity and the opportunity for people or businesses, specifically tennis clubs, that they could be operational.
Right. Thank you,
Okay?
Dr. Wooten.
All right,
Yes.
thank you.
Thank you. Just one quick clarification on that. Churches required us to have the affirmative decision of our public health officer, and so those will be effective midnight tonight, along with the one-on-one golf instructions. But hair and barber shops, provided that they can fill out their safe reopening plan, post it, go through all the things that they need to do, those are cleared to open as soon as they complete those steps. So I agree, most of them probably won't be able to do that today, but if some of them are, then they are allowed to open effective immediately.
And it's from Mike McKinnon with KUSI. In New York, the beaches are closed to swimming, but gatherings of up to 10 are allowed on the sand. Here in San Diego, we are allowed to swim, but not be on the sand. Officials from both places say the rules are made to increase safety of the residents. Why is there such a big difference between regulations here and in New York when it comes to the beach?
Well, in San Diego County, the determination was made that it is unlikely you're going to get spread for folks who are in the water. The reality is you don't get mass groups of folks swimming or surfing right next to each other, and so the risk of spread or contagion is very low. It is greater on the shore, where people might gather and sit in large groups in close proximity to one another, and so that's why in San Diego County we've allowed the water activities and we've limited to date the gatherings on the beaches. It makes sense from a public health standpoint, and it makes sense in our desire to reopen things and allow for recreation, but do it in a way that is safest. As for New York's decision on why they made it, you would really have to ask them but we feel confident in the underlying public health rationale for the decisions we've made surrounding beaches. Okay, for those of you who are still here, we're going to jump into our slides here. We got them updated again. My apologies for the error earlier. We'll go through these quickly. Again, there today you can see 85 new positives out of 3,908 tests. We go to the next one. This one represents ICUs at 160, and then total COVID-related hospitalizations, non-ICUs there at 385. And then on the next one, you can see how that translates. That's our 385 COVID, non-COVID, well under that 80% bed capacity that we are reserving for our COVID. And then on ICUs, you can see right here the blue representing COVID-related ICUs at 160, the red representing non-COVID ICUs for a total of 438, and that puts us at 62% of current ICU bed capacity presently being utilized. So our apologies for the wrong slides earlier, but there you have the correct ones for today. Thank you.
Well, that concludes our questions for today. Before we conclude, I just wanted to thank everyone who really is helping to get us through this pandemic crisis in a safe manner, with very few exceptions. People followed the public health order over this past Memorial Day weekend, and for that we sincerely thank you. That's what is really allowing us to ease up on a lot of these restrictions, and we need to keep reminding everyone that the virus is still out there, and it's still something we have to deal with. There's positive cases that are coming up every day, and I guess the important thing is just say we can't let our guard down. You know, I want to give a shout out to AM/PM Arco station in Chula Vista. I went in there yesterday to get some gas, and I was at the pump. I was by myself, so I didn't have my mask covering my face, but I wanted to get a receipt when I got done, so I went inside the main part of the gas station, the convenience store, and they wouldn't let me in because I didn't have my mask on my face. I had it with me, but I wasn't deploying it. So kudos to them. We need more businesses that are taking that type of approach. It's something that's really important if we're going to keep this virus contained. So I thank them for enforcing the rules. With that, we will conclude for today. We will not have a press briefing tomorrow, but we will be back here on Thursday at 2:30. So stay safe and keep wearing those facial coverings. Thank you.